Is there a typical time frame for the immune system function to return?
I would say a year is a good time, but it's a very unpredictable wave. So again, unlike a stem cell transplant where you have a clear time where the cells are low, they recover, they stay recovered, we have noticed for some patients, they may have low blood counts just during that first month and then be recovered. Some will have no problems in the first month, and it's in the weeks to follow that suddenly either the reds or the platelets or the white count may need support. And in very rare instances, out to a year, they're still needing support, sometimes, say, a growth factor injection once a week.
Mm. So, how is it monitored over time?
We monitor all those different levels of the immune system. So we check on the CBC, which is the very common blood counts. We also look at what is called a lymph panel to look at the different types of T cells and make sure that they are recovering. Those usually take about 3 to 6 months to recover. The white count, again, usually by day 30, but there are some cases of delayed recovery. And the immunoglobulins, which is the antibody level, we also monitor monthly.
What other side effects should patients who are considering CAR T cell therapy be aware of?
So really, those are the big three. I would say others are very rare, but the low blood counts is the one that lasts beyond the time in the hospital, and the rare neurotoxicities that are delayed.
When should patients mention any issues they're experiencing to their healthcare team?
Always is a very, very short answer. Please don't ever think you are bothering the doctor. I hear that a lot. Oh, I didn't want to bother you. It is never a bother. This is why we are here. So anything that is happening that is out of the ordinary, please let your healthcare provider know. If it's not something that needs our attention or we don't need to worry about, we will tell you.
Better safe than sorry.
Always.
And how does a care partner factor into the process? It seems like having a good support system is essential.
It absolutely is. I think the entire journey of myeloma really is what I would consider a team sport. It is not something we go through alone. And the more members of the team you have, the better. So as your medical team, we always value the caregivers. For CAR T specifically, since there is this concern for infections and neurotoxicity, caregivers are really essential. They should be well informed, know what to look for, and be the ones to reach out to us if anything is concerning. Again, any symptoms out of the ordinary, any fever, and really be a part of communicating with the medical team.
Is there a period where patients are considered out of the woods from CAR T side effects?
Hard to say. Again, I'd like to emphasize that most patients by day 30 or 60 are back to work, are feeling themselves, are recovered. Another contrast to stem cell transplants, it's a much faster recovery. I have patients who within 30 days are eager to go back to work and don't know what I was talking about or why I insist on seeing them so much. But some patients, again, out to a year, may still be requiring visits for support in their either the IVIG for the immunoglobulins, growth factor support for their counts. So there are outliers at both extremes. We follow the model of 100 days for recovery.
Do some patient types do better than others?
Well, always yes. And we are still endeavoring to figure out who they are and why that is. So there are things that we don't know, can't predict, but things that we do recognize are, again, bringing patients whose myeloma is under good control. So instead of having a lot of disease or disease that is in a growth phase, we try to use the bridging therapy to optimize the patient, not only to improve the response, but also minimize the toxicities.
Does age have an impact at all?
Not as much. We actually have just finished an 88-year-old patient whose hospital course was remarkably unremarkable, as we would like. So I think another difference from stem cells, it is not as rigorous. And while, each patient, I think, should be part of that decision and that conversation, reviewing what is now a growing number of options and see if it's right for them as an individual. So age is a consideration, but frailty will always be the more important.